I'm Hilary Baker. I'm the lead CNS for Uro-Oncology at UCLH, and that is managing the pathways for the diagnostic, surgical and surveillance pathways. And as part of my work, I also manage and provide professional leadership to a team of 17 CNSs and one support worker. I have been a cancer CNS for 30 years, and I have been in nursing for over 43 years. I showed an interest in this particular project because I identified during my career as a cancer CNS that we in cancer nursing have a very high expectation of nurses to transition into these roles without any real formal professional development. And I felt that with my knowledge and experience, I would be able to contribute to that by being part of this project. The Cancer CNS Development Lead project is a project that we have funding for 36 months, thanks to Macmillan and NHS England. There's a project team that have worked very tirelessly for the last few years on really identifying what is the workforce issue within cancer nursing. And we've identified that there's a lot of attrition in student nurses leaving nursing. We've also identified that there's senior nurses in cancer nursing that will soon be retiring, and that'll mean that very junior nurses will be coming into those posts. And there's a lot of nurses that are working on their own, not part of a team, and not necessarily getting that professional support that they require in order to develop their skills and competencies to be an autonomous practitioner. So this project is a Pan-London project. It's a great collaboration across London. I haven't ever seen a project like this before. And as a result of that, we've employed 5 cancer CNS development leads across London, working in the 5 clusters in London. And their role is very much to support newly appointed cancer nurses in developing their skills and competencies and their confidence in order to deliver personalised cancer care to patients using the aligned to the Ascend framework. So it's very important in order to support newly appointed cancer CNSs in order to develop their capabilities as a nurse to deliver personalised cancer care to patients. And this has come at an excellent time when the Ascend framework is available, that we can then work together in order to provide professional guidance for nurses to meet the necessary capabilities to be a cancer CNS. My hopes for the project are that this is alongside the that this is adopted into cancer nursing practice, that this is very much reflected in the independent report that's been provided by our evaluation team, that will show that this role is really, really key to cancer nursing, and that not only is it adopted in London, but it's adopted nationally.
I'm Liz Qualia. I'm the CNS development lead for North Central London. I've been in post since September, and I have a long background in oncology nursing. I've been qualified since 1996, and I've been working in oncology almost ever since then. I've been a CNS for the best part of 20 years in a variety of different roles. And I joined the team of CDLs in September.
So my name is Michelle Harris. I'm the Cancer CNS Development Lead, otherwise known as CDL as well, for South West London. I started the role in August last year. I've been a cancer CNS for the last 20 years in a variety of different specialities as well, and have been working as a cancer nurse since the year after I qualified, so 1997 as well.
Initially, I wanted to scope the workforce and just see what kind of workforce was out there and what kind of support we could offer, and then worked out which nurses I was going to support, and I landed on supporting the newly qualified CNSs, or the people new in post, um, because I felt like they were the ones that needed the most detailed support from us. I now have 21 nurses that I support in that way, using the documentation that we're given through the project. There's also a group of universal support nurses that I support, and that's mainly structured around teaching, but also some interview preparation and some working with people preparing for becoming CNSs. I am providing coaching, so that's a large element of what I'm doing. So the work that I'm doing with the individual nurses is predominantly a mixture of coaching and mentorship. And I meet people on a fairly regular basis, and those sessions are quite clear coaching sessions. I'm also working with people within their clinical practice, so I'm working with people within their clinics, in their MDTs, and other elements of the CNS role. Is there anything different that you're doing?
So no, really similar to you, Liz. So I spent my first 5 weeks within the role, embedding myself in each of the different 5 hospitals, meeting all the key stakeholders that were involved within the CDL role. So lead cancer nurses, lead nurses, and then understanding the cohort of CNSs that I would be providing the enhanced CNS support for. At the moment, yeah, I have a similar number of nurses that I'm supporting, so around 20, and providing monthly kind of coaching, mentorship, reflective practice sessions for them. That could be attending clinical areas as well, MDTs, just to understand their roles, and then looking at embedding the Ascend framework with those nurses, and understanding their career development. Similar to you, in terms of the universal support, I'm providing teaching in 2 of the hospitals so far that is hopefully about inspiring nurses to come into the cancer CNS role, and other kind of less qualified or more qualified CNSs that may want developmental support as well.
Primarily, it was something that was really different and really challenging. Having been a clinical nurse specialist for so long, it really is where my passion lies in terms of the nursing workforce. I think the CNS workforce is central to everything that's happening with the cancer work in hospitals. And this project was the opportunity to get involved with something that looks to develop those nurses, whereas it's a fantastic job and you're central to everything, but it can be a very difficult job. And I think it was the opportunity to see if we could look at a better way of supporting CNSs in their workforce, and see if there's a better way of doing it.
Yeah, so really similar to Liz. I think that being a CNS for 20 years, I remember the very early days of how difficult it is to become a CNS from coming from a non-CNS role, and remembering putting my head at my desk thinking, how do I do this? And so the passion for the role, and that provision of that just really unique, privileged advice to patients, and just wanting nurses coming into the role to really want to kind of run with the role and understand all the different elements to it. I think people come into the role not being sure, so I think it's about helping them develop, and work to the best of their potential, I guess. Yeah.
I'm hoping that we prove concept that this role makes life easier for CNSs, and that it allows people to have that level of development of support that isn't there. Everyone's line manager brilliant, but everyone is so pressured that I think this workforce does need that level of extra support. I think the key will be that we can make it sustainable so that we can, all of the progress that we make within our roles, it would be really nice to make that sustainable in some way. And I think that will partly be using Ascend and implementing Ascend and leaving that as our legacy, I would say.
I completely agree, and I think kind of early feedback from the nurses on the ground that we're supporting is that they've never had any support like this, and so even nurses that are kind of watching in that are more experienced have commented on, how valuable this role would have been for them. And I think it's like any other developmental role support, it feels really invaluable. So I'd really like to see a form of this role definitely continue.
I've been working in dermatology for almost 9 years. Prior to my CNS role, I've been working as a staff nurse, and where I gained lots of experience and knowledge in looking after patients with various skin conditions. And I started my post as a CNS last year, May.
So I qualified in 2015 and I went straight into general practice and worked as a practice nurse for a few years and then did a few master's levels modules like my non-medical prescribing and became a nurse practitioner. And more recently, in July 2024, I became a clinical nurse specialist in the Rapid Diagnostic Cancer Clinic at Kingston Hospital.
When I worked as a staff nurse in dermatology, I was always passionate about the expert care CNS provided, guiding patients from the diagnosis to the treatment and beyond. So I was very keen to develop myself in that field, and I took every opportunity to learn. When this job available, I thought it's best for me to take, and I can specialize further. I can give best possible care to the patients.
What made me go into the clinical nurse specialist role, in particular, was working in general practice and being exposed to people who were either being referred down diagnostic pathways or who had come back to general practice after having treatment, for instance, after prostate and breast cancer, and actually we were administering some of their treatment. And I grew interested in that area and the idea behind sort of early diagnosis and improving sort of outcomes for the patient group.
Moving forward, I think I really want to enhance my clinical leadership and advanced practice skills, doing some trainings like educations, like specialized training in oncology and masters in dermatology. In fact, I'm starting my first module this week in masters, so I'm very much looking forward to it. I think all these trainings, I believe that it's going to help me to give best possible care to the patients with the latest evidence and things, and also I'll be able to perform better in multidisciplinary team meetings and things like that.
My future career aspirations would be to hopefully complete my master's in advanced clinical practice and also just become more confident in the role that I'm in at the moment, so learning a bit more about cancer care in general.
Cancer CNS development role is helping me in many ways. Being new in my CNS role, having support from them is really making me grow in my position, helping me to get more confidence in my role. I have very supportive team within dermatology I work, but having extra very dedicated mentor to help new CNS like me is very reassuring, and I really appreciate that. And I also find the one-to-one meetings I have with the team is very helpful, where I get a chance to discuss about various things like training needs, career pathways, and how I can improve or build more confidence in certain areas. For example, like how I can be more proactive in MDT meetings. So all of which are currently helping me to settle in well in my role. And also I see how everything the team is going through is aligns with Ascend framework, which is giving me clear understanding of my career development and my practice as a CNS.
The Cancer CNS Development Lead role has been very fundamental actually in my transition into a role in oncology and as a clinical nurse specialist. She's signposted to me the education resources, linked me up with other CNSs, and given me an overview as to what is a CNS in oncology, particularly with reference to the Ascend framework, and marrying up my competencies against that and identifying where I may need to focus on in the future.